The following portion of Daytime is sponsored by Florida Urology Partners.
The CDC reports prostate cancer is the second most common cancer affecting American men. It's also one of the leading causes of cancer death among men of all races. And joining us now to share the warning signs and treatment options you'll want to know about is Dr. Ravi Bukkapatnam. He is president of Florida Urology Partners. Doctor, welcome back. Nice to have you here.
Thank you so much for having me.
What would you like everyone to know about prostate cancer, and what are some of those warning signs that often go ignored?
Well, you know, it's one of those diseases that sometimes gets brushed underneath the rug, and it's something we need to talk about, something that we need to bring to the forefront of discussion. And so to do that, one of the unfortunate things is that it doesn't always have any symptoms associated with it. So it's often a trip to your either primary care physician or urologist to be evaluated. And then beyond that, it's typically just a lab test and a physical exam that can help detect it. The biggest key to this, all of this, is that early detection leads to much better outcomes.
How frequently should men get this checked, and at what age should they start?
You know, there's a lot of debate about this topic, and we've in this country gone back and forth about it, but we still talk about having an annual evaluation with your physician.
Once it is detected, you pride yourself in being with that patient throughout the entire journey, from diagnosis to post-treatment. Talk to us about how you do that and why it matters so much.
You know, having a compendium or a full access to all sorts of different therapies is critical again. And so we really pride ourselves in holding that patient's hand all the way through the entire journey. And to do that, whether it's surgery or radiation or even just active surveillance or observation, we really hold a patient's hand through the journey, through the process, to make sure they have a good outcome at the very end. And again, typically with early detection, they do. And that's the exciting part of what we do.
The kind of care that you're describing is the kind of care any patient would want, but you also want to go somewhere that is the best. So I know that you pride yourself on your standards of excellence. Would you speak to that?
Absolutely. So we, again, have physicians that are very highly trained in handling specifically prostate cancer as one of those conditions. And we have access to really very contemporary treatment options, whether it's robotic surgery, whether it's radiation therapy with different protective agents that we utilize to minimize side effects. There's been a tremendous burgeoning of new technologies and techniques in the management of prostate cancer. And so having a physician that has experience with it and really has started from the beginning is key. And at Florida Urology Partners, we're really privileged to have a team that is very used to, very able in delivering these options.
And doctor, in our last seconds, briefly address the women, because I don't think that we ever think about the women's side of urology.
I'm so glad you asked that question. I think, you know, 50% of our population is women, and we, in urology, that sometimes gets forgotten. And females, women also have very similar conditions that don't get talked about: incontinence, prolapse, various types of urologic dysfunction, voiding dysfunction that needs to be addressed.
All right, doctor. Thank you. Always a pleasure having you here with us.
Thank you so much for having me.
You're welcome. And if you'd like more information or to make an appointment, you can visit FloridaUrologyPartners.com. Daytime will be right back.